Okay, so imagine this. There's a pill out there, a single pill, that can almost completely stop someone from getting HIV. Sounds like a miracle, right? It exists. But what happens when a medical breakthrough like that runs headfirst into the messy, complicated reality of our actual lives? That's what we're going to dig into.
First things first, let's get our terms straight. We're talking about something called PrEP. That stands for pre-exposure prophylaxis. And all it really is a daily pill that, if you take it the way you're supposed to, is incredibly good at preventing HIV infection. So, on paper, it's a total game changer, an absolute home run. But like we said, what actually happens when this so-called wonder drug leaves the lab and enters the real world? To get some answers, we're going to look at this really fascinating study from a hospital program over in Barcelona, Spain. They decided to follow almost 300 people who were at high risk for getting HIV, just to see how PrEP really works when you're not in a perfect, controlled clinical trial. Now, the program had one main goal. Just one. Super simple. Stop new HIV infections from happening. That's it. So you gotta ask, how'd they do? Well, on that one primary goal, it was a massive success. I mean, out of almost 300 people, after a whole year, there was only one new HIV infection. Just one. That's wow. It really shows you how powerful this medication is. So yeah, the program worked. A clear win. But, and this is a big but, here's where the story starts to get a little more complicated. While people felt safe from HIV, another really common behavior started to change. A lot. And you can see that change right here. At the very beginning of the study, about 41% of the participants were using condoms for anal intercourse. But after a year on PrEP, whoa, that number plummeted all the way down to just 13%. So the logical next question, right, the one you're probably thinking right now is, if condom use is dropping that much, you'd have to assume that other sexually transmitted infections, other STIs, would just go through the roof, right? But here's the twist. That's not what happened. The study found that the overall rate of other STIs actually stayed pretty stable. And the researchers think they know why, because the program itself included regular STI screenings every 3 months and quick treatment. They were basically managing that risk as they went. So the pill worked. Other infections were managed. Sounds like a total success story, doesn't it? Well, not quite, because the data revealed this much deeper problem, a kind of hidden hurdle that had nothing to do with medicine and everything to do with, well, being human. And this is the number that changes the whole story. Look at this. After 1 year, only 57% of the people who started were still in the program. A shocking 43%. We're talking nearly half of the participants were just gone. They'd either dropped out or been lost to follow-up. I mean, just think about that for a second. The pill works. It works almost perfectly. But what good is a perfect pill if almost half the people who really need it aren't even there to take it? This is the real puzzle of the study. What was going on? Why were so many people leaving? And to get to that why, we really have to understand who these participants were. It's their lives, their situations that give all this data the context it needs. So, this wasn't just a random group of people. The participants were 99% men and transgender women, about 10% were sex workers, and look at these last two numbers. Over half, 55% reported practicing something called chemsex, and 63% reported engaging in group sex. You can see this is a community dealing with a lot of different layers of vulnerability. So what is chemsex? It's a key term here. The study defines it as intentionally using psychoactive drugs, things like meth or GHB, for the specific purpose of making sexual encounters easier, more intense, or last longer. It's a huge factor in understanding this group's world. So when the researchers looked closer at exactly who was leaving the program, a really clear pattern emerged. The people most likely to be lost to follow-up are transgender women, sex workers, and folks who engaged in certain high-risk behaviors. In other words, often the most marginalized and vulnerable people in the group. And this led the researchers to a pretty powerful conclusion. I'm just going to read it straight from their paper. We should target specific strategies to improve adherence and retention in care as vulnerable subgroups are identified. Basically, they're saying you can't just hand out a pill and walk away. You need specific plans to support these groups and keep them connected to care. And that right there, that brings us to the real lesson of this whole study. This isn't just about one drug or one program. This is about how we think about public health as a whole.
The researchers point to this idea, this framework, that helps us visualize the entire journey of care. It's a really helpful way to see what's happening.
It's called the PrEP care continuum. Think of it like a chain with 4 links. First, you need awareness. People have to know PrEP exists. Then, uptake. They need to be able to get it and start it. But the whole chain breaks if you don't have the last 2 links: adherence, which is taking the pill consistently, and retention, which is staying in the health program over the long haul.
So here's the bottom line. What the Barcelona study really proves is that the medical breakthrough, the pill itself, that's just step 1. That's the easy part. The real fight, the biggest challenge out here in the real world, is in steps 3 and 4, helping people stick with it and stay connected to care. Which leaves all of us with a really big question, one that goes way beyond just HIV. We have these amazing medical tools, but how do we build health programs that actually support the entire person with all their complexities, instead of just treating a risk factor? Now that's the real challenge ahead.